Disc prolapses present in different ways. Sometimes it's just some lower back pain, can be quite dull but very persistent. But more typically, it presents with pain which radiates into one or other leg or one arm or the other. Sometimes it even presents with radiation into both legs. If there's a disc prolapse in the lower back, then you get symptoms going into the leg. If you get a disc prolapse in the neck, then you get symptoms that go into the arms. Sometimes the pain that radiates into the arm or leg is also associated with some numbness, and sometimes it's also associated with some weakness. In very severe cases, it can also present with altered sensation of the bladder or bowel, or a change in control of the bladder or bowel. And in those situations, it's an emergency and you need to go to accident emergency straight away. But most things can be dealt with without an emergency appointment and simply need to be seen in outpatients, usually urgently. The first thing to remember with disc prolapses is that most of them get better by themselves, and most of the time the symptoms get better by themselves. So the first treatment is time. The typical time for pain from a disc prolapse to improve is 6 to 8 weeks. Painkillers can obviously be used, especially if the pain is quite strong and severe, to allow people to remain mobile. Trying to remain mobile and active is also a good treatment and has been shown to reduce the amount of time that it takes for people to improve from their disc prolapses. If time and pain relief is really not working or the symptoms are very bad, then we can consider doing epidural injections, which can take the edge off the pain and push things in the right direction towards natural healing. And if that's still not working, then an operation to take out the disc prolapse is usually quite a successful and relatively predictable surgical option that works well. Disc prolapses do not always correlate that well with the symptoms. So sometimes you can have a very large disc prolapse and very few symptoms. And sometimes you have a small one and it's very painful. And so it's important not to focus too much on the MRI scan and the size of the disc prolapse, but rather on the symptoms themselves and whether they're improving or not. Disc prolapse generally presents to spine surgeons because of pain. And if the main problem is pain, then we escalate through painkillers, injections, physiotherapy. And if all of that hasn't worked, then an operation is a good option to try to manage the pain, take the pressure off the nerve from the disc prolapse. But it doesn't always just present with pain. Sometimes there's also weakness in the leg. Typically, this can be something called a foot drop, where it's difficult to lift the toes and the foot up, or weakness of pushing down with the foot, so it's difficult to get up on the toes on one leg or the other. If there's weakness, then this may also be an indication for disc prolapse surgery in order to try to limit any nerve damage and hopefully give the best possible opportunity for recovery. Another strong indication for surgery is if there's bladder or bowel dysfunction or altered sensation. And in that situation, emergency surgery is usually indicated to try to prevent permanent incontinence. For disc prolapse, most disc prolapses are in a location in the spine that can be accessed relatively easily, and removing the disc prolapse does not change the stability of the spine. Typically, microdiscectomy is performed, which is done through a small cut in the lower back and has a high success rate in treating disc prolapse. Less invasive options have been utilized, such as endoscopic spine surgery or tubular spine surgery. And this allows the incision in the back to be slightly smaller to achieve the same outcome, and therefore the recovery times are thought to be a bit quicker. Having said that, the results at 3 months with all the different options seem to be about the same. Disc prolapse surgery is a very common and routinely performed operation, and most, if not all, spinal surgeons will be very familiar with the surgery itself, and will do it very in an expert way. The complications that may occur, however, are related to the approach, and in order to do this kind of surgery, the lining of the spinal nerves, called the dura, needs to be uncovered. So you can get an injury to that lining, and if there is an injury to the lining, then that gives you a leak of spinal fluid, and that can cause headaches. Your spine surgeon would repair that straight away. Doesn't usually cause long-term trouble. You can also have an injury to the nerve that's being decompressed because it needs to be moved out of the way in order to take the disc prolapse out. That could give weakness or numbness in the distribution of that nerve, and that doesn't always completely recover. But it's relatively uncommon to get weakness after this surgery, although numbness is relatively common. You can also get an injury to all the nerves at that level, and that is quite rare, but that could give weakness in both legs or bladder and bowel dysfunction. Because there can be some bleeding around the time of an operation, occasionally after an operation, there can be a collection of blood, which is called a hematoma, and that can put pressure on nerves and can even do damage to nerves too. And so that needs to be looked out for and mitigated against. So sometimes a further operation is needed to let out any collection of blood if it's putting pressure on nerves. There is a risk of getting an infection, and the rate of that is of a deep infection is quite low, less than 0.5% in most places. But a superficial infection just in the skin is much higher, maybe as high as 5%, although normally that can just be treated with a short course of antibiotics. Recurrence is also a risk. There's after discectomy or surgery for a disc prolapse, there is a small area of weakness at the back of the disc, especially early on. And if there's loose material within the disc space, then it can come out into the same location and there can be a recurrence of symptoms. If that happens early, then revision surgery is usually the way to manage it. If it happens late, after 6 months, then you start again with physiotherapy injections. And if nothing is working, then revision surgery may be reasonable. If you have 2 or more disc prolapses, then spinal fusion may be the next step. There's also general risks of surgery, like getting blood clots in the legs or lungs. Some risk of general complications like a urine infection or a chest infection. These things are rare. And then there's extremely rare complications which happen once in a blue moon. And most spinal surgeons will probably not encounter in their careers with this kind of surgery, which is not surviving surgery, so dying at the time of surgery, or becoming blind. While these are very extreme complications that rarely occur, fortunately, we do not encounter them frequently.